giving you a quick update on the situation as it relates to transmission of COVID-19. The received reports of 10 new positive cases today, 8 on Oahu and 2 on Maui. So as of today, there are a total of 26 confirmed cases of COVID-19 in the state of Hawaii. The 10 today were the result of extensive testing and analysis by private labs around the state. We have now over 1,000 samples, sample results over the past week or so, and again, that's contributing to our total database on the extent of COVID-19. A couple of very important points to make is that all of the cases, as far as we know, have a travel history or are individuals who have been exposed to someone who has been traveling. And that's significant, and that we believe at this time there is no evidence of extensive community transmission in the state of Hawaii. We have completed a second round of testing as part of our Sentinel surveillance program, and we have received no reports of any positive tests among those individuals. Those are individuals who have respiratory illness for which the flu has been ruled out as a possible cause. Those we think would be the individuals most likely to have been exposed, and again, we're not seeing that any positives among that group. That study is ongoing, and of course we'll be getting additional information over time on the spread of the virus as we get more results on that. So the good news is that there doesn't seem to be any evidence to date of community spread. Bad news is, of course, we are continuing to see the disease being brought to Hawaii by visitors. By the way, a number of those are residents. It's not just visitors. They're returning residents who have been to places where there has been some active disease. I wanted to emphasize a couple of other points that I will make before we answer questions. We have recently launched a new dedicated COVID-19 website. We have really good information on current case counts and probably more importantly, guidance for people who are concerned about what they should and shouldn't be doing. Our focus going forward has been on social distancing, basically ensure that you're not in a situation where you're communicating the disease to others or others transmitting the disease to you. Social distancing is really the way that this illness is going to be stopped in its tracks, and we'll be hopefully able to prevent a situation that's being seen now in many other states and areas where the disease is active. So the actions the governor has asked for are particularly important now. We want to deal with the issues. We want to prevent the disease before it gets into our communities, when it's really too late to make effective changes. So I would urge that everyone pay attention to the recommendations being made and adhere to those. I have with me Dr. Park, and she may have some additional information on the cases that were reported today. Again, I emphasize that we've had 10 new cases, largely as a result of the sampling testing that's being done by the private laboratories, and of course all those results are being transmitted to the physicians or the healthcare providers who ordered the tests. Sarah?
At this point, we don't have a lot of information, I have to say, on the cases, in that, as you can imagine, with 10 all at once, there's a lot of work that needs to be done. So investigations are ongoing. What we do know so far is that, so far, what we're learning is many of them are either directly travel associated, or at least in the case of one individual, maybe is indirectly travel associated. In similar to the previous case where there was no travel associated, but working in the visitor industry, we have another case similar not exactly in the visitor industry, but very much exposed to a lot of visitors potentially. So we are investigating further on that case. I think it's important to note also that many of the cases, in fact, I think so far what we're finding as we investigate each of the 10 cases is that there are our own Hawaii residents who are coming back from travel. Those who have traveled are coming, are basically our own Hawaii residents. So I think it's really important for all of us who might have traveled to be mindful of your health as you come back. That you stay home if you especially if you have any illness, monitor yourself, and when you do come back, just to try and limit your exposures to other people, you limit your interactions for at least 14 days, just so that in the unfortunate circumstance that you've actually been infected with COVID-19 or any other infection, that you do not pass that along to others. So, thank you.
If I could remind everyone, please keep your questions really concise just for time, and we'll go to KHON first. Bruce has one of the people.
Yeah, that's right. We're not using that. I'd like to make one more point, and again, Dr. Park might want to elaborate on this. A lot of testing is being done across the state. Much of it being done by private laboratories or individuals using the services of private laboratories. It's very important that people not go to those testing centers unless they're ill, unless they have symptoms that are similar to COVID-19. And all those individuals should be checking in with their healthcare provider before they go. They're going to need to get an order from their healthcare provider before the test is run. The problem with people coming to these centers is they're using up valuable supplies, protective equipment, swabs that are being used, and they are in short supply these days. There are across the country shortages of these materials, as well as reagents for testing and so forth. So we want to use the testing materials that we have efficiently and, of course, most effectively in identifying individuals who are likely to be ill, and so that resources can be directed accordingly.
Okay. Thank you, Dr. Anderson. Okay, now to KHON. And if you could direct your question to either Dr. Anderson or Dr. Park, that'd be helpful.
Okay, we're ready for questions. Anyone have questions to
Just
either of us?
KHON first.
Oh, I'm sorry, KHON. Sorry about that. First.
Go ahead. Okay, unmute your phone by hitting *6. Alrighty, well, we'll move on to KITV and we'll come back to KHON if time permits.
Hey guys, did you say KITV?
Yep.
Yes.
We can hear you.
Hey, we were just wondering if with all these new cases, are you guys still saying there's no community spread in Hawaii?
I think it's important to understand what the difference, what do we mean by community spread? What is the definition of community spread? So the definition of community spread is essentially when we investigate a case and we determine that there is absolutely no link to potential travel, whether it's directly or indirectly. If we have a case where we do not see that, then that could potentially indicate community spread. Community spread means that there's person-to-person transmission occurring in our community. It's not being introduced by somehow through a traveler who came in, whether it's directly or indirectly, the person themselves traveled or the person who's infected is infected by someone who traveled. So that's what we're talking about, community spread. By identifying the cases right now, what we know of so far is that almost all of them have had direct travel exposure. And again, at least 2 individuals we know of so far. And again, investigations are still ongoing for a lot of the new positives today. But 2 of the individuals have indirect exposure to travel. So doesn't mean necessarily that there is absolutely no community spread at this time in Hawaii. It just means we're not seeing widespread community transmission. There still exists the possibility that there could be localized transmission we have not yet picked up. I think what's important to note is the numbers of people that have traveled or have travel exposure that we're now picking up, because every single person that we pick up that is in the state of Hawaii, in amongst our communities, and especially among our residents, not the visitors, it's our residents, because think about who actually associates in our community. The visitors don't know anyone, so they're staying by themselves, but it's our residents. Think about yourselves, and you go and have potluck with your friends and family. It's our residents, so again, need to be mindful that every single new case is a potential for introducing that community transmission, starting community transmission somewhere in our state if it already hasn't happened.
Let me elaborate a little bit and give you an example. We had a case in Kualoa Ranch, which has been well publicized to date. That was an individual, a tour operator, who had contact with hundreds of foreign travelers, many of whom undoubtedly were from areas where COVID-19 is common. There was concern about exposure to family members, and unfortunately, results came back recently that none of the family members that were tested were found to be positive. That is fortunate. Had the situation been otherwise, you would have had a situation, of course, where someone was exposed to a traveler and then transmitted it to their family and then possibly to others. Mm-hmm. That would be what we consider indirect travel associated, and that's what we have seen to date. We haven't seen a situation where someone is, or groups of people have been exposed and we can't track the sources other than local sources. So there's a gray area there when we talk about the community spread. Clearly transmission within a family theoretically or could be considered community spread, but having said that, we're not seeing any widespread evidence of community transmission where we would see the disease popping up in different areas in individuals who had no travel history. That's what we worry about most, and that's what's happening in many states across the country.
Okay, thank you. Hawaii News Now, please.
Yes, can you hear me?
Yes.
Go ahead. Hello?
Yes.
Hello.
Hawaii
Okay.
News Now, go ahead, ask your question, please.
Hi. Hi, can you hear me?
Yes?
Hello.
Yes.
Yeah, we can hear you. Can you hear us?
Okay.
Yep.
Yes, I can. So there are 26 confirmed cases. Josh Green said there's 27. What number is accurate?
At this time, okay, the numbers of cases will continue to grow because testing is not done only at one period in time, okay? So there are likely going to be cases that show up as or are identified as the day goes on. So, but as of noon today, the case count is 26. Between noon today and noon tomorrow, that case count likely will change. What it will change to, I can't predict. But those cases, those new cases, will be added to the following day's case count. So the case count for today is 26. And honestly, the count is not the relevant issue. The relevant issue is that there are positive cases. They're mostly travel associated, either directly, and then there are a few that may have are likely indirect association with travel. Each one of them is a potential for introduction into our community to start community spread, and that's what our community needs to understand. That it's why it's so important. Social distancing is so important. Keeping our distance. If you've traveled, when you come home, monitoring yourself, your health. Keeping your distance from others as much as possible for 14 days. Until those 14 days are over, you really need to be mindful. And if you do fall ill, if you have mild illness and you're otherwise healthy, stay home. If you have underlying issues or if you're older, please call your doctor and get advice from your doctor.
And can you give us a breakdown of the numbers?
If we could hold on,
island?
just one question first, and then we'll come back to you. All this information is going to be available on the website as well. So
By island as well.
yeah. So let's go to the Star Advertiser next, please. Unmute your phone, star 6, please. Star Advertiser, if you're there. There we go.
Yeah,
Can you hear me?
Yes.
Yes.
Go ahead.
Okay, so the Lieutenant Governor and health providers are calling for a mandated shutdown of all businesses, schools, and non-essential travel in Hawaii until April 30th. Are we planning to do that?
Well, the governor has already called for non-essential travel to be eliminated. So that's happening as we speak, and businesses are closing all over the state. Many of the businesses here are taking voluntary action and in fact, very aggressive actions to prevent the spread of COVID-19. Restaurants are closing as ordered by the governor. They're switching over to takeout and delivery. We've got many businesses around the state already closing. Some are considered essential. Of course, we've got restaurants continuing to provide meals. Obviously, the supermarkets and other outlets for food are essential businesses. Many of the retailers are also closing, and I think wisely so, to avoid crowds and other situations where people may be transmitting the disease from one another. So strategically, we are looking at closing businesses that are considered non-essential. But having said that, there is no mandate, nor would it be appropriate at this time to close all businesses. Again, we're stressing social distancing and of course, actions to enhance that going forward.
I think it's important to note that regardless of whether closures happen or not, we are not living in life as normal, and we will not be. It's not living normally for some time. We are in a marathon in responding to this pandemic, and so when the closures happen, I think, you mentioned April 30th as a date. Quite frankly, that may be too soon to even think about reopening if the closures happen. So everyone needs to understand that whenever certain things happen in terms of whether it's mandates or whatnot, it will not be business as usual, life as normal for quite some time. It could be months, potentially through the end of the year. And so every one of us needs to prepare accordingly. And that really is the more important focus for all of us. And it all revolves around social distancing.
Okay, thank you. Let's go to the Associated Press, Jen Kelleher.
Hi, this goes along the lines of what Lieutenant Governor Josh Green is recommending. Why not mandate quarantine for those who have traveled within the last 14 days? You seem to be putting the onus on people who haven't traveled to focus on social distancing, but why can't the responsibility fall on travelers, whether they be tourists or residents? Other places have mandated self-quarantine for those who have traveled in the last 14 days, and these are places that don't have widespread transmission. So why not take more aggressive action to stem travel-related transmission?
We are, in fact, recommending self-monitoring for anyone coming from the mainland or internationally as appropriate, and in that process, if an individual is identified as having being ill, then he or she needs to see a physician, and of course we are also, as well as recommending self-monitoring, urging that they not get into situations, crowded crowds or other situations where they may be potentially infecting others. One thing to keep in mind as we go forward on this is that people are most infectious when they have symptoms. And obviously that's when you really want to hunker down and not expose anyone to this disease. So when someone is traveling, they should certainly stay away from others at least 14 days after returning, and generally avoid contact with other people.
Which is to say that, Hawaii, we're blessed in that we have beaches, we have places you can go hiking. Those are safe. I mean, if you're outside and there's no one around, you can still go surfing. Just keep your distance from your surf buddies. I mean, just keep them a big difference. I mean, think about it. 14 days, if you are well, are you going to really stay home for 14 days? So it is about balancing what we know, human nature, what people will abide by, and I think people will understand understand that we need to protect our community, keep our distance from others. I would actually put to you to why don't you look at those other communities that are mandating 14-day quarantine, and I would be curious to know how they're enforcing this on their traveling residents. Remember that a pandemic may be occurring, but
They're going hotel
big-
to hotel, they're
but-
going home to home, they're arresting people who are not complying with quarantine. And I'd also like to mention that Mayor Caldwell yesterday closed parks, including Ala-Moana Beach Park.
So as far as you can still go for a run in your neighborhood, you can still go for a walk. So you know, again, it gets back to social distancing is really important. Our police forces throughout the counties are already short on staffing. Regular business is still going on in terms of, you know, law enforcement issues are still out there. You know, pandemic may be occurring, as I was starting to say, pandemic may be occurring, but other diseases, other conditions, law enforcement issues, all those things do not stop just because of a pandemic. And so we do need to make sure our law enforcement can deal with those things. You know, in addition to it's essentially trying to find the balance to make sure that our community is protected.
I believe Mayor Caldwell, I listened to the broadcast yesterday, even mentioned that you could walk across the park and go to the beach. I believe what we're trying to avoid is
But you can't park,
people
you're
having.
going to have to trespass to a closed area to get to the beach. And you won't be able to have access to restroom facilities.
That's true. You won't have access to restroom facilities. The parks are considered closed, but even when they're closed, that doesn't mean you can't go out and take a walk and enjoy the outdoors. Again, the key here is not quarantine. It's not what's closed and what's open. It's really to assure we have that social distancing. We're keeping apart from people who may also be infected or who may be infected and not to transmit the disease from one another.
Okay, thanks, Dr. Anderson. We need to move along.
But the
So we
message
Jen,
would
hold
have
on,
to be
please.
stronger,
Jen, we need to move on to the
right?
next question, please. Hawaii Public Radio. HPR?
Hi. Yeah. Can we get an accurate number of the number of tests run for surveillance, number of tests run by the state, and then you said 1,000 have been run by the labs, and if there's any movement to expand state testing?
Well, let me start with that. There are 30 or 40 tests that have been done. 40 tests done by the state laboratory pursuant to testing individuals who are under investigation. Those are seriously ill individuals who are being tested locally. In addition to that, we have our Sentinel surveillance program, which I mentioned earlier. The Sentinel surveillance program has now tested 124 individuals who had respiratory illness who did not have the flu. 0 of those were positive. And of course, the private labs are now testing individuals who are referred to them by physicians. And we have over 1,000 reports from them. Obviously, most of them are negative, but the 10 that we reported today, I believe, were all test results received from private laboratories. So that number is the 1,000 is rough. We're getting reports every day, and undoubtedly that number will increase dramatically as we go. That is the number of people who are being tested, and of course we receive the reports whether they're positive or negative.
There is a distinction in the types of tests, how the testings are being applied. So in terms of the clinical commercial labs, they are basically all comers, as far as I understand it. We are advising clinicians when they order the test to consider prioritizing. And so if you look at what we're finding as positives coming out of the clinical commercial testing, again, many of them are travel associated. When you look at what the Sentinel surveillance is attempting to achieve, we're testing those with no travel association at all and had mild illness. And then with the patients under investigation, we're looking at those who are seriously ill. So they're basically looking at 3 different populations, if you will. And so that that is helpful to us to be able to understand scope of disease, burden in Hawaii. But regardless of any of all that, it's still important to understand that in order to prevent the situation that we're seeing in other states and other jurisdictions, it really is coming down to making certain all of us as a community practice good social distancing.
Okay, let's move on to Civil Beat, please.
Yes, hello, can you hear me?
Yep.
So, just wanted to clarify, Dr. Park, earlier, I think it was KHOM's question. What do you mean when you say infected indirectly by travel? Does that mean someone infected by someone else who went abroad? Or
Correct.
Classified as travel related?
Right, that's exactly.
That's not actually my one, I just wanted to clarify.
Yeah, that's exactly right. So, so when we're saying travel indirectly associated with travel, it's usually someone who has many exposures to travelers and documented usually because of their occupation. So an occupation that, and where we have confirmed through their history, they have a lot of exposure to travelers. So in that case, we were unable to exclude the possibility of travel-associated infection versus a community-associated infection. So what we're looking for community transmission is someone where.
I understand.
Okay.
Thank you.
My real question, I just needed to clarify that.
Yeah. Hold on. Is this still Civil Beat? We'll come back to you if we have time. Let's move on to Maui News, please.
That wasn't my question. It was a clarification.
Oh, clarification. Okay, go ahead.
One more question from her.
Yeah, go ahead.
Go ahead.
Go ahead.
Can I ask?
Yes.
Thank you. Of all the confirmed cases, how many are related in family clusters, and where have they traveled? And in general, like how many are over 65, how many younger, please give us some demographics, and where they've traveled, because you keep on emphasizing they have been traveling.
Yeah, unfortunately, again, 10 cases came in since midnight last night. We are still in the process of interviewing and investigating. Think about your own associations, and I think you'll understand that it's not as easy as just coming. I understand in this day and age of snap your fingers and you've got instant information. Talking to people and getting history from people is not always about getting instantaneous information. So we will provide the information when we have it. We're just as anxious as all of you. I can tell you among the 10 positives, there is at least one family involved. So it's not just, so they would all have the same exposure. But I can't. That's the best I can tell you at this point, and just say, give us some time to be able to collect information. So when we provide it, we know it's accurate.
Let me add a little bit more to that. So, looking at the positive confirmed cases today, we have cases from all counties, generally proportional to the population of those counties, probably reflecting the number of travelers in most cases in those counties. The demographics are no different here than what we're seeing across the country. Typically, the older individuals have been having much more serious illness than the younger ones. And there's no distinguishing between males and females. So we have pretty much the same demographics in our case histories as you've seen elsewhere. The important point, I think, is that we're not seeing any widespread community transmission yet. That's important, and I want to make sure that everyone understands that these bold and very aggressive measures that have been taken here in Hawaii and throughout the U.S. are to prevent the spread of disease, and we're in a very good position now to implement those in a very strong manner to prevent the problem from occurring here that we're seeing throughout the world. So this is the time to act. We shouldn't wait until we have community spread to act. It's a time that we want to be doing our best to keep the disease from spreading in our communities.
Thank you. Maui News, please.
Hi. What is the feasibility of the DOH accepting test kits from places outside the CDC and the U.S. to help meet our testing needs?
While that may sound like a great idea, there are two issues. One is that any test kit that we would use needs to be approved for use by the U.S. Food and Drug Administration. There are very strict federal laws, and we need to be mindful that if we use these tests, we're not breaking those laws. The other thing is that for every test kit used, every testing that is done, that is one set of PPE that we're robbing from the healthcare workers, okay? And there is a critical shortage of personal protective equipment for our healthcare workers. If we want to make sure that they are appropriately supplied to be able to take care of all of us, not just for COVID-19, but for all the other respiratory pathogens, for other conditions, protect our immunocompromised out there, we need to make sure that when we test, we're testing judiciously. So we need to consider that when we accept what I've made comments about. If we do get the green light to use these test kits, I would hope that whoever's offering them is offering comparable amount of PPE as well, so that we do not rob from our already shortening supply.
Yeah, I would just again add that laboratories are struggling all over the country to keep up with the volume of testing. And in fact, many of them are reportedly running out of reagents and other chemicals that they need to do the tests. So this is not a problem unique to Hawaii. Every state's having to deal with shortages in protective equipment and laboratory supplies, and we need to conserve and protect those. Our state laboratory, I think, is in pretty good shape. According to our lab director, Dr. Desmond, he has sufficient reserves to be able to do the testing we need to do on those who are seriously ill. Those are the ones we really want to be
As
sure
well
are
as the
tested.
sentinel surveillance.
And the sentinel surveillance. In fact, we are planning to continue to sample for that program. We have currently 124 samples in hand. None of them were positive, but we want to continue that program. That's the best indicator we have of how this disease is spreading in the community and how it might spread in the future if it is spreading.
Okay, thank you. Robbie from Honolulu Magazine.
Hi, can you hear me?
Yep.
Yep.
There's been some controversy across the country about how people are tested in famous people versus not famous people. Daniel Day Kim did the Instagram post today explaining what he did. Did he do it properly according to how he described it?
I have to admit, I've not had the occasion to watch his Instagram post. I'll try to take a look at it, but honestly, I've not seen it, so it's hard for me to comment. I will just reiterate that persons who seek testing, you should consider the fact that if they are in the older age group, they have underlying illness, they should contact their doctor because they're at risk for potentially severe disease. All the rest of us who have mild respiratory illness should please consider to not expose others, stay home. Something I've reminded my clinical colleagues yesterday when I conducted a grand rounds with statewide was reminding them that we are dealing with a virus that causes potentially in its severe form a viral pneumonia. The clinical management for a viral illness does not change regardless of what the diagnosis is, whether it's flu, whether it's adenovirus, whether it's COVID-19. The only difference might be is if you have a severely ill patient, in which case that's someone who's hospitalized, by the way, in which case that person might be a candidate to be enrolled in a clinical trial for the drug remdesivir, which even though there is that trial, we don't even know if that drug really is helpful. That's the only difference that it might make to know that someone is COVID-19 positive. For all the rest of us, it really is important to make sure we're checked in with our doctor, they know about our illness, but that we stay home and recuperate and recover, because the data shows that most people will recover just fine.
Robbie, your question was, are we sort of, if you read through lines, are we selecting individuals who we're testing based on their notoriety or whatever the case may be? And obviously, the answer to that is no. The testing we're doing at the health department are tests referred to us by physicians around the state and based largely on the symptoms being presented and, of course, an exposure history which would suggest that they are at high risk.
And he was tested through a clinical commercial lab, my understanding.
Yeah.
And
So we don't have.
What he said,
Go ahead.
well, let me clarify that what he said that he his symptoms worsened. He contacted his doctor. He self-isolated, and he only went to drive-through testing after his doctor told him to. And he thinks he did not receive any preferential treatment. I was just wondering if you wanted the opportunity to address that.
Yeah, so if his doctor advised him, so he did, then that, if that's the case, he did the appropriate thing. He consulted with his doctor by phone. His doctor would know his personal medical history, and based on that, his doctor would have made the call. And that's the important thing, having that healthcare provider-patient relationship and letting your healthcare provider make that assessment for you, not yourself.
Okay, we have time for one final question.
Yeah, sorry. This is Sarah from Channel 2. Can I ask a question?
Yeah, Sarah, we'll come back to you. We're going to do Max Dibble first from Big Island now, and then we'll come back to you if we have time, Sarah. Thank you.
Okay.
Max?
Sure, you hear me, yeah?
Yep.
Okay. So my question is, every single island has increased measures for, social distancing. You said closing bars isn't really the issue. You need to social distance, but it seems like that's a pretty, big element of it. So I'm wondering if anybody at the state has reached out to Mayor Harry Kim on our island and advised him that the decision he's making is endangering people's lives here.
This is Bruce. I had a conversation with Mayor Kim yesterday, and of course urged that he consider any venue where people may gather as a potential area where people may transmit the disease. I think you're going to find this to be an evolving situation where additional measures will probably be recommended as we go along here. The governor did recommend that bars and restaurants be closed, and that the restaurants at least be pivoting from food service to in-house to takeout and delivery and so forth. And I expect that will continue. We're going to see probably additional recommendations coming down the line as they relate to other matters. I would point out that the mayor on Kauai actually has imposed a what do you call it?
Curfew.
Curfew, yes, and people are going to take actions which they think are appropriate on their particular island, and you will probably see more stringent actions being taken as we go in different places depending on the circumstances. So this is going to be a judgment call on the part of the mayors and others who are struggling with this issue, just as we are here at the state.